Hi, all. Hope each and everyone is doing well and good. And it is me, Dr. Amrita here. So, why am I here today? Because I want to speak about a update, and second one, I want to clarify a doubt from my mail. Actually, Dr. Kannan Venugopal have sent me a mail, and his doubt was, how is diploma course? So I'll be dealing about this too, because these two is going to be very important. Because of that, I'm here, and this video will be very short. I want to say the matter and just wind up. That's all. And first update is, you have seen my recent YouTube video regarding this NEET PG 2025 cutoff and the score thing. Under that, I am receiving so many messages. From that, I understood that there are so many candidates better than 450 and 575. So many candidates, because if you analyze those scores, and there are so many candidates between these scores, actually between this 570, between this 450 to this 575. So many candidates are there, and from that I understood that yes, they are going to happen a huge rank shift will be happening better than this course, because so many of them are there in 500 range. And in that situation, you can say that yes, each and every negative counts here. From this, I understood that each and negative score, there'll be a huge shift in the ranks can occur this time. That because above 600 also, I think one or two of the message, but many of them better than this 500 range, so many, and as well as this from this 450 also. And again, I want to say yes, negative actually matters, and so many of them got very good score, but the negative actually just like a snake and ladder game, finally, like when snake engulf, we just come little bit down, just like that. I think negative have affected some of them, but don't get worried or tense, because most of their situation is also just same, just like that. Most of them were affected with negative, and nobody were there without negative marks. There were nobody. So it so happens. Don't get regret or cry because I got this much mark, but I have got this many negative. Oh, what happened? Actually, this happened to most of them. So never get disappointed. We can always hope for the best. Yes, as always I say, difficult roads often leads to beautiful destination. You will definitely get the branch and the seed that God or Almighty have already designed for you. And the second thing is that Dr. Kannan asked me this doubt regarding this, how is diploma? So first of all, I want to say that if this is this NEET PG, your attempt is more than 2, yes, think about more than 2 or 3, just think about diploma. Otherwise, your first attempt and going to diploma, no, you can actually try for another trial also, next attempt also. But if you're more than 2 and you feel like that I don't want to go with the NEET again, I'm just fed up, then I want to say that who all to take this diploma means, in your mind you feel that I can deal only with a clinical branch. I cannot accept any of the branch. That means a score or rank you have got. For that, you may get MD, non-clinical or paraclinical subject. You will get MD. Okay, but in your mind saying that I cannot adjust with either non-clinical or paraclinical. I can deal only with clinical branch. If your mind says like that, then go with diploma. The thing is that if you feel like I can live only with this clinical life, yes, again I say go with diploma seat. And the thing is that always understand that after getting the diploma, if you're planning to work in a corporate institute like Amrita Institute of Medical Science and all, you cannot work with diploma in these kind of corporate institute. It will be difficult. That is a drawback. But if you feel like if you want to start a clinic, you are on setup, and if you're planning to go to some of the clinics like GPs, like if you're a pediatrician, I personally know a pediatrician when I was working before 3 years I was been working in one of the private hospital along with government job. At that time I used to work that time, so I know a pediatrician. Actually, he got his degree was diploma. What he did was he used to choose 5 or 6 hospitals. See, every day he will be going, like Wednesday one hospital, Wednesday and Thursday one hospital, the other hospital, like that he will be doing. So 2 or 3 hours only he will be going, but he is getting superb salary per hours. He will be charged so many, so he was making so much money in that way. As well as he runs his own clinic means in his home itself, one room for just seeing the patients consultation purpose. So he makes in that way also. So if you feel like you want a clinical setup, like diploma is very good for that. And also if you're planning to work in a government setup, diploma is superb actually. See, when you look the government notification, especially the Kerala, I will say they will, if they were there is a post for pediatrician. So the qualification will be MD bar DNB bar diploma, and the wages salary is going to be same. So whether you took MD, whether you took DNB PEDS, or whether you took diploma, your payment is equal. In government setup, there is no change. And also, if you're planning to settle in government, also wise opinion, because you can become like assistant surgeon. There are so many other posts like you can apply for this PSC and all. You will be having a very good income, as well as everything. Your life will be secured in that way. But if you are planning to work in a corporate or private setup, it matters. There are certain there are certain hospitals in Wayanad, Idukki, in Kerala, that region. They actually take this diploma, also diploma also like diploma pediatricians, and also there were vacancies also there in most of this. But the thing is that the genuine fact is that MD, when there is an MD doctor, MD consultant, and difference between the MD consultant and this diploma consultant is that in private hospital there will be difference in the wages, in the salary, because when compared to the diploma, the MD doctor will be earning more, because there is a bit a difference in the salary wise. That is the main point. But in government setup, it doesn't care. And also a diploma is only just 2 years, and this NBMS itself conducting the diploma exam also. It is actually easy, not that tough, because one batch actually passed out, so you can ask them already passed out, and one is going to be. So that exam is also is not that tough. And if you're planning to pursue DNP also after this diploma, you can choose DNP also. And the problem in DNP is actually when you compared with MD, leaves is going to affect, because DNP there is no that much leave, but MD you have like so many, like maternity leave and so many leaves you can take actually. But DNP, when you compare, the leaves are actually lesser when you compared with MD, because in DNP, if you get a like private hospital, there's so much work you want to do, and if you feel that I don't care, I want to get into my dream life, I want to enjoy with all these degrees, of course there is no restriction. You can definitely go and conquer anything if you have that mind. Of course you can do it. And after pursuing DNP, you are feeling like, yes, it's time for me to get an MD degree also. If you feel like that, of course you want to write NEET exam, NEET PG exam again, and if you qualify that, again MD, then you can settle. And also I want to say that diploma is only 2 years, and DNB as well as MD is 3 years. If you pursue this diploma, then you are going for this thing, then you're going for DNP, not 3 years, just 1 year is less, 2 years. So yes, this is about the difference between the diploma, DNP and MD. I again want to say that in your mind says that Dr. Navi, sorry, not Dr. Kannan, if your mind says that I can go only with a clinical branch, yes, of course, no issue. You can start can start a clinic by yourself nowadays. So much, if you're so much very good income you will be getting. And if you guys ask me personally a question, which diploma is actually good, if you ask me, it's a very secret thing. If you're looking the salary wise, then I will say that OBG and our pediatrics, OBG and pediatrics is the best, because you can make lots of money actually. As well as ENT is also okay. ENT is also ENT of TAL is also good, but more when you compare with the other two, OBG and pediatrics is more like, because baby wala and pregnant, so many cases everywhere, so you can you can income wise it is very good, and all other depend upon yourself which field you like, and everything depends upon that. So if you feel like I want to go with the clinical branch, I cannot deal with paraclinical or any of this, if you are just like this, just go with diploma. There is no issue. 2 years you will pass out. This GPs you can take, or you can again along with this GPs you can start your own clinic and work, enjoy your life. This is all about your determination is what I personally know. So many of them who took gynec in Pondicherry, and n number of cases they have done. And another some of my colleagues, they have actually passed out, and they were working very well in some of the private hospitals also. I told that private hospital take, but there is not a corporate, not a big corporate like medical colleges like Amrita, not like Amrita, other like mini hospitals they will take. So there is no issues, nothing, because there is a very big roads. Again I want to say that if you are if you're planning to pursue only diploma, okay, yeah, that's up to you. The difficult roads are actually less. But if you're planning to go with DNP and MD, it is always superb. Getting the amazing degree, it's always wonderful. But one thing I want to say, that the roads there may be thorns. You feel like that I'm ready to pick away those thorns, and yes, I'm going to move away. Of course, you can definitely do it. And also, I want to say that, yeah, I met one of the pediatrician, one of the famous pediatrician in the government medical college, and she's a very, very well popular doctor. And what she did, there is a superb idea that I will say to you. That is a very amazing idea. What she did was, she took diploma. Okay, she took diploma 2 years. What she did was, she get into this our PSC thing. She get into the PSC health service quota. Then what she did means, she attempted this our NEET PG. So she prepared. She prepared means what? There will be like 3 or 4 hours morning only duty. After that PHC, if you get a PHC, that only 3 to 4 hours only duty. So rest of time no night duty. It's superb for her. So it's all depend upon which all institute you pick up. That's all. So what she did was, she took up diploma and she wrote this PhD exam. So she get into the health service thing. Now what she have? She have got the reservation, that is health service quota reservation she have. So then what she did means, she studied for NEET. And what is the advantage? Health service quota competition and the NEET PG with the other 2 lakh people is actually writing the exam. So health service quota competition is less. So she superbly and easily she get into this MD pediatrics itself. So that is a wise way. I'm sure that nobody have said to you. Maybe someone have already told, just simply only told. And yes, so roads are wide enough. Yes, if you have the courage, if you have got the determination, yes, of course, yeah, just go and enjoy your life. It's all important is, at the last day you should be happy. And one more thing I want to say, that I have started working with Signer with the Malayalam NEET UG counseling thing. That is Malayalam. If any of the Malayalis is watching my channel now, please help me. What is, like, I have put in my post that Signer Kerala NEET UG counseling link. Please share it to any of you, any of the candidates like NEET UG who are just going to grab an MBBS seat or BDS seat, because those students doesn't have much idea how will be the counseling and all. I actually trust this Synod. Synod is actually a genuine site. So this is not a paid promotion. I just want to say that I'm working with Synod, that NEET UG Malayalam channel. So if you know any of the students, because I don't know the students not personally that much, if your sister or anybody is going to grab an MBBS seat, if you know, please do send. I just beg you guys, please do send that link and ask them if they have got a groups like, well, so many students after soon passed out this +2 and they were looking this like repeaters and all this NEET UG or coming. Please do share it. I beg you all, please. It is going to be a favor for me, because that definitely help these students, because the Synod, actually in that video we are just explaining all those processes in Malayalam itself. So it's an update, all genuine things and new updates we are just providing. So please help me to share it, and that's all. And thank you all so much for watching, and it is me, Dr. Amrita here. Thank you all, and all the best for you all. Thank you.